Hi, I'm Brindley McKague, and I'm doing my advanced physical assessment with my husband here, Jared. So, I'll start off. So I'd come in, knock, wash my hands. Hi, my name is Brindley. I'm a student nurse. Can I get your full name and birth date?
Jaron Lamar McKague, and June 1st, 1996.
Alright, Jared, do you have any allergies?
No.
Alright, I didn't see any on your chart. Make sure my area is safe, provide privacy. Jaron, today we're going to be doing an advanced physical assessment to give your doctor a baseline of where you're at, okay? Alright, so I'll start. Jaron, what is your age?
I am 23.
Alright, and what is your ethnicity or race?
I'm white.
Alright, and what was your sex at birth?
Male.
And your current gender orientation?
Male.
Okay. And then I can see that his overall appearance is well groomed and that he's dressed appropriately for the weather. Could I get your height and weight?
6'3", 230.
Alright, so you're 6'3" and you weigh 230. Alright. Okay, and then next I would take his vitals. So if I had a thermometer, I would take his temperature. So often we have temporal ones. So I'd swipe across the forehead and go behind the ear. I would take his pulse. So using the radial pulse right here, and then as he is doing that, I can also check his respirations. His respirations would either be regular or irregular, and I'd also assess if they were deep or shallow, and then I would assess if his pulse was regular or irregular. And then we could take his blood pressure, which I have my blood pressure cuff right here. For the sake of time, we'll keep going. And I would assess if that was normal, and also clip on the oxygen oximeter and get his oxygen levels as well to make sure that he's getting enough air. And once we do all that, Jaron, are you in any pain today?
Nope.
Okay. If he was, I would be able to assess the onset, how long it's lasted, if there's anything that makes it worse or better, the quality of the pain, rated on a scale from 0 to 10. If there's any medications he's taken, the location of it, if the pain is temporary or intermittent, or if it's long lasting, and I would go into that exam. And then after we've done that, we're going to do orientation. So, Jaron, what's your name?
Jaron.
And then where are you?
At the hospital.
Alright, what day of the week is it?
Tuesday.
Alright, and what am I holding?
A pen.
Okay, so he's orientated times 4, so I would chart that. And then I would say that his speech is clear and understandable, it's not too slow, and I've already talked about his appearance. And then Jaron, I'm going to give you 3 words to remember for the end of the assessment. That's pen, pencil, and paper. Okay, got that?
Mm-hmm.
Alright, so after that, I'm going to assess the general appearance of his skin, and I'm going to do this throughout the assessment. So I'm checking for any tattoos, piercings, bruises, or rashes, anything that I should be concerned about. Make sure his skin is an appropriate temperature and not too moist or clammy, using the back of my hand. Nope, it's warm and dry. And then I would also check to see how hydrated he is, or if he had any edema. So I can pinch the skin on the back. I return immediately, so his skin trigger is good. And then once we've done that, we can check our cranial nerves. So the first nerve we're going to check is your olfactory nerve. So that's your nose. So can I have you plug one of your nostrils? Alright, and then smell this with that nose. What is it?
Chapstick.
Like
cherry.
Yes, there you go. And then the other side?
It's lip balm scented, like original scent.
There you go. Alright, and that works too. And then I don't have with me, but we would have a Snellen chart to check his optic nerve. So I would have you read, like, the big letter E all the way down. Have you read as far as you could. So pretend you're reading. So name the letters.
E, M, S, I, F, G.
Perfect. Okay. And then we're going to check your oculomotor nerve. So I'm going to have you cover one eye, and then I'm going to shine this light into your other eye. Alright, great. We'll do the other eye. Great. So both of his pupils are equal in size, they're round, and they react to light. And then I'm going to make sure that he can accommodate. So follow the pen with your eyes without moving your head. And as we're doing this, we're also checking the trochlear nerve and the abducens nerve. Perfect. Awesome. So I know all three of those nerves are working. And then we're going to test the trigeminal nerve. So I'm going to have you clench your teeth, okay? And I'm going to touch your face. Alright. Great. And we know that that's working after palpating. And the next nerve we're going to check is your facial nerve. So squint your eyes shut. Alright. Raise your eyebrows. You can open your eyes now. And then puff your cheeks. Alright. You can stop that. Frown. Smile. Alright. Perfect. And so that I know his facial nerve is working, and as well as, can you feel that?
Yeah.
Okay. And then we'll check your accessory nerve. So can you move your neck all the way around and roll it? All right, great. And then your hypoglossal nerve, can you stick your tongue out and move it side to side? Awesome. All right, we're going to check your glossopharyngeal nerve, which I'm going to check your gag reflex, okay? So stick your tongue out.
Yep,
Yep, and there it works. And then just stick your tongue out and say, ah. Okay, and your vagus nerve is also working. Great, I'll throw that away. And then, yep, so we've got all of your cranial nerves that are working great. So then I'm going to assess and look at his general face. So I see that his eyes are symmetrical and that the sclera are white. And can I pull in your eye a little bit?
Mm-hmm.
Yeah, the eyelids are pink, as they should be, a little pinkish red. So that looks good. Then I'm going to look at his ears. Both ears look good and symmetrical. I'm going to touch the tragus and the auricle. Are you feeling any tenderness there?
Mm-hmm.
Have you felt any tenderness so far?
Mm-hmm.
Okay, good. And once I do that, I can check the nose. So, any tenderness in your nose?
Mm-hmm.
All right. Do both nostrils work? Yeah, you can breathe through both of them. All right. Both nostrils are patent, and I could use my pen light and assess more. And then we'll look at the mouth. So his mouth doesn't have any lesions. Can I look at your gums? All right. Yeah, gums are pink. I don't see any lesions there. There's nothing making it hard for him to breathe. Once we do that, I can look at his neck. So make sure his neck is symmetrical. I don't feel any lymph nodes. So you're healthy. Good. I don't see any deformities, which is great. And then we can start assessing his lungs. So first, when we're looking at his lungs, I'm going to assess for the 6 sounds. So I'm going to start and listen here and move all my way down. When you feel the stethoscope touch you, I need you to take a deep breath in, okay?
Yep.
Okay. It might be a little cold. Good job. Good. All right, and I'm going to go up under here. All right. Breath sounds are clear. I don't hear any crackles or rhonchi or any wheezing. And his breath sounds are regular. And I'm going to look at his overall chest width, his ratio, and it is 2:1, so I know he doesn't have a barrel chest, and it's healthy. And then I'm going to assess the back. And I'm assessing both the front and the back to see any deformities or misshape. And he's not misshaped. Can I have you turn that way? Yeah, just turn change your position. And then we're going to listen to the sounds in the back. So breathe in. All right. Good. I didn't hear any noises there. Oh, can I have you keep going that way? Thank you. So I'm going to put both of my hands on your back, and I'll have you breathe in. One more time. Alright, so I feel both of the lungs extend, and then I'm going to have you say the word 99.
99.
Okay, say it one more time.
99.
Good. So I can feel the vibrations on both sides of the lung, so I know there's not any filling with fluid or anything like, or collapsed lung. And I'm going to stick my hands up underneath your ribs. You got a lot of ribs. Alright. And do you have any tenderness here?
Nope.
Alright, so he has no CVA tenderness either. And so, chest expansion is good. Now have you breathe in one more time? Yeah, both sides are elevated. Great. Alright, now that we finished our lung assessment, we can do our cardiovascular assessment. So I can have you turn back around. Alright, so first we're going to assess the jugular veins. So I don't see that they're extended, which is good. And then I'm going to check for your carotid pulse, alright? There it is. I had to push a little deeper.
Thought it was dead.
No, you're good. And I see that his pulse is regular. And a 2+ rate, so that's good. I see both of those. And then we can palpate, and as I'm listening, I'm going to be listening to his heart sounds and be checking for any thrills or anything that's indicative of a heart problem. So Jaron, we're going to be listening to your heart sounds.
Okay.
We're going to start with your aortic over here. Good. And then we'll listen to your pulmonic. Good. Then we'll listen to Herb's point. And the tricuspid valve. Good. You have a good heart sound. And then we're going to listen to the apical mitral. And this is the pulse that I would listen to for a whole minute while holding on to his radial pulse to make sure that they're matched. And I would assess, there we go, assess for any pulse deficits. Perfect. All right. You have good heart sounds that I could hear. And they were regular as well. Okay, the next thing that we're going to assess is your abdomen. So normally I would have you lay back, but we don't have a recliner here or a hospital bed. So I'll just have you lift up your shirt, and I would assess. I don't see any redness or lumps that I need to be worried about. There's no issues or deformities with the belly button. And then we're going to listen to all 4 quadrants. Good. Good. So his bowel sounds are regular. I heard good active sounds, not too active or hypoactive. And then right before we move on, I need to palpate your stomach. So I'll just take my hands. Do you have any tenderness there? All right. And his stomach wasn't too firm. It was tender with no pain, which is good. It was soft. And then when was your last bowel movement?
Yesterday.
Okay. And then, do you ever have a hard time making it to the toilet on time?
Nope.
With pee or
No.
poop? Okay. And then what color is your urine usually?
Like a pale yellow.
Okay.
Or clear.
And it is clear? Good.
Yeah.
So it's not cloudy or filled with sediment? Alright. Do you have any pain or burning when you use the bathroom?
No.
Alright, great. So then I have assessed the urinary system. And then I'm going to check all his pulses to make sure they're working. So I can feel for his brachial, which again I would also have checked for when we took his blood pressure. And then the radial pulse, good and regular, a 3+. And then we would check for the posterior tibial pulse, which is behind the foot, behind his ankle, back here, which can be a little tricky. Don't flex your foot. And then I would rate that, and then I would have him take his sock off, but we'll feel the dorsalis pedis pulse right here. I can actually feel this one. It's got a good strong one. It's like a 1+ through the sock, but we would check to make sure all of those are working. We already checked his carotid pulse. And then we're going to move on to his muscular system. So we're going to look at the general appearance of his arms, make sure that there's no crepitus and that there's no extra warmth or anything like that, that they're comfortable. Yep, at an appropriate temperature. Can I have you move your shoulders up, down, backwards, forwards, and then all the way around forwards, and then roll all the way back. Alright, so he has full range of motion in his shoulders. Any tenderness with that? Okay, and then bend your elbows. Yeah, extend and then reflect them. I always forget the word. But both ways, he has range of motion there. And then with your wrists, go down, up, side, side, and all the way around. Okay, he has full range of motion in his wrists. And then the same with your fingers. Extend them and retract them. Awesome. And any tenderness when you do any of those things? All right. And then I'm going to hold your arms out. And then I'm going to press down and I'll have you push up, okay? Oh, good. So he has equal strength on both sides of his arms. Any tenderness with that?
No.
All right. And I'm going to have you close your eyes and I'm going to touch your arms with my finger and you say yes when you feel my touch, okay?
Yes. 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 Yes.
Okay, and so he has a sharp response to the sensations that he feels. And then after we've done that, I would do the same thing with his legs. So I'd check overall to make sure his legs don't have any deformities, any edema, any rashes or anything like that. And can I have you stand up and move your hips? So forwards, backwards, side, side, all the way around. There you go. Can you bend your knees and extend them? Any pain with that on either side?
Nope.
All right. Yeah, have you sit back down. And then can you move your ankles in all directions? So I'd have them up, down, side to side, all the way around. Can you move your toes? Crinkle them. Yep. Any pain with any of that?
Nope.
All right. And then I'm going to do the same with your arms. I'll have you try and press up against my hands. All right. Good equal strength on both sides. And then same thing, I'll have you close your eyes, and when you feel my touch, say yes.
Yes. Yes. Yes. Yes.
All right, so he has a sharp response to the sensations there as well. And so we've done assessing all of the muscles, so now we can assess his balance. So I'm going to have you stand up and walk towards the door and walk back. All right, his gait is steady and regular. It's not unbalanced. He has good, strong steps. All right, I'm going to have you stand up, close your eyes, and hold your arms out. And then he would have to stand like that for 20 seconds without falling. And I'd make sure he is safe. If it was a fall risk patient, I'd probably stand behind right here to help. And so we'll say 20 seconds has passed and you have good balance. And then I'll have you walk heel to toe in a tandem walk. And still has good balance and coordination. Can you close your eyes and touch your nose? All right, he found it. Can you touch your thumb to all of your fingers? Awesome, good coordination there too. And what are the 3 words that I gave you at the beginning?
Pen, pencil, paper.
Yes, there you go. So we've now finished our assessment. If there's anything you need, I can give you your call light. and I would record all of my findings and give it to my provider when needed.